Cancer is a continuously growing global health problem that poses major challenges, most especially in developing countries. Find out how this international distributor of innovative health products came up with a series of solutions to help increase a patient's chance to survive the odds. In 2020, the Philippines hit a record of 354,398 prevalent cancer cases within a 5-year period. But because of poor access to health care, especially for people living below the poverty line, the advances and breakthroughs in cancer remain unattainable to many.
Cancer refers to a group of diseases that's characterized actually by cell growth, abnormal cell growth and proliferation, inflammation, as well as angiogenesis or formation of new blood vessels. It always starts with mutation in the genome or the genetic makeup of a person inside the cell. Before PAPS, most of my patients, they were unable to finish the chemotherapy regimens because of the side effects and because of discomfort during the process of chemotherapy.
Maria's son Dominic was diagnosed with stage 4 rhabdomyosarcoma when he was only 4 years old. While coping with the recovery of her other sick child, Maria found it hard to accept Dominic's condition.
It was actually very devastating kasi with Dominic, it was manifested mga 4 years old na siya eh. Unlike dun sa daughter ko na congenital talaga, baby pa lang. Yung mga bandang September, meron ng umuumbok-umbok dito sa leeg niya. Hindi ko talagang inisip na cancer kaagad siya until nag-nosebleed siya.
Dominic was prescribed chemotherapy, but his family insisted to rush to an integrative doctor to seek for alternative cure.
Medyo hesitant ako kasi as a mother, I know the side effects ng chemotherapy kasi. So what I did is that I rushed towards the integrative doctor of my daughter, who happened to be PAP partner doctor of Simply Nature.
One of the hardest decisions to make for people living with cancer is choosing the kind of treatment that would work best. To help patients and their families deal with this growing health problem, one company commits to producing safe, credible, and natural health solutions by drawing on the latest bioscience technology to deliver a series of safe, efficient, and natural products. What is Simply Nature and what does it do?
Simply Nature is a company we created and founded about 10 years ago. Our mission is to find effective health solutions for people. So we provide natural products that work in combination with conventional therapy and medicine.
As an international company that provides natural solutions for cancer, metabolic syndrome, and degenerative diseases, the management upholds a health philosophy that centers on whole food nutrition as the frontier in health management.
When we talk about choosing treatment, especially in the area of cancer, patients are really afraid of chemotherapy because of its side effects, and they tend to then look towards natural products. But this is not either conventional or natural choice. At Simply Nature, patients can have the best of both worlds. Our protocols work with conventional chemotherapy to minimize its side effects so that they can get the best treatment using both conventional and natural together.
Cancer is like a virus. It continuously evolves, it mutates. So it can develop defenses against our usual treatment modalities like chemotherapy.
Like I said, chemotherapy and radiation therapy have a lot of side effects. So more often than not, patients stop their treatment because of these side effects. It's very important to have the support.
With the supplements that we give the patients, there will be lesser side effects, so they will be able to finish their chemotherapy protocols more comfortably.
This company introduced PAPS, which is touted as one of the best natural ways of solving serious health problems.
PAPS stands for peroxisome proliferator activating receptors. It's basically a nuclear receptor found inside the cells. Now, when these receptors are activated, the benefit that you can get from that is, number one, cellular differentiation. Number two, it's to promote fatty acid metabolism. If you have better insulin function, your blood sugar will naturally go down. And another one is to induce cancer cell death by modulating the immune system.
As a sole distributor of PAPs, the company promotes its use to many reputable health institutions worldwide and actively organizes corporate health conferences and public health talks in Asia.
Simply Nature PAPs is made out of a special strain of these types of microalgae. It is very effective by protecting the bone marrow. We maintain the integrity of the immune system of the patient, which is very important to prevent infections and to fight off the cancer itself. And also, Simply Nature PAPs is also very dense in nutrients so that the patient can recover faster because of better cellular healing.
Sabi ko parang na-lead kami to an extraordinary and I must say amazing journey. I'm very proud of him. At a young age, na 8 years old, he believed that it's his purpose to siguro encourage other people then. We would like to really pay it forward with the knowledge that there's really like Simply Nature that can help people with cancer very much.
When fighting cancer, living healthy is very important because it allows us to pursue what is important to us in life, and that's what it's all about. When we can help a patient move from being bedridden to getting up, to be lucid in thought so that they can have conversations with their loved ones, it gives the whole process of fighting cancer a whole new meaning. And that is what drives us at Simply Nature.
But I really wanted to share yung poem from childhood. So 100 years from now, it will not matter what my bank account was, the sort of house I live in, or the kind of car I drove, but the world made the difference because I was important in the life of a child.
Good morning, everyone. We are from Simply Nature, and that is Tito Shen, and I'm Tita Jesslyn.
And you put your on your chest, say, Jesus loves me.
Jesus loves me.
For our gratitude, Mr. Shan. Ito na ba ang mga sundalo ng Israelita?
Maliit man ako sa iyong paningin, malaki ang aking Diyos. Tutulungan ako ng aking Diyos at lalabanan kita at tatalunin kita.
Nayanig ang paligid sa pagbagsak ng gulayan.
Si Mother Ricky, pasalamatan naman natin si Mother Ricky at palakpakan din natin siya kahit siya ay nasa ibang lugar ngayon. Paano kayo di gagaling, di ba?
Pinupurit, sinasamba kita.
And Lord, we believe you for testimony from every child in this place. In Jesus' name we pray. And all God's people say, Amen! Hallelujah!
Nung 2022 po, yung parang inipon ko talagang pera pambili nung Simply Nature, nung vials, na PAPs. Yun po yung iniinom ko.
Cancer lang siya, strong tayo. Kaya patuloy lang po tayong lumaban kasi may Panginoon tayong gumagabay sa atin lagi. Yun lang.
And on behalf of the Simply Nature team, God bless you all. Maraming salamat for blessing us this day. We hope that we have made you all happy. God bless you once again. Here in Simply Nature, we are always with you from start to healing. Thank you, everybody.
CA markers.
Mataas siya. Then, nung after 3 months, nung pag-take ko ng Simply Nature, doon, naging normal na siya until now. Kahit si Dr. Johan na gulat siya kasi biglang normal agad in just 3 months, nag-normal agad yung CEA ko. 1 year and 5 months. Cancer-free. Dapat may food supplements kayo. Like Simply Nature na proven and tested ko na. Talagang hindi ako pwedeng mawala ng Simply Nature na yan.
2019, I was being diagnosed a cancer of my uterus. So I was shocked. Sabi ko, bakit nagkaroon ako ng ganito? Samantalang hindi ako mahilig sa pagkain. I'm sorry, basura. Started the tablet and then the powder. Tinry ko din yung yung tawag dito.
Gel?
Yeah, yung gel. Yes. It's really good. After 2 months ng aking therapy and taking PAPs, sabi ni doktora, magpa-laboratory ka na. So, nung nagpa-laboratory na ako, praise God, 2 weeks ago or 3 weeks ago, lahat normal. To God be the glory. Salamat sa Diyos. Sa 2 months ko po ng aking pag-take ng PAPs, ako po ay cancer-free.
Welcome to another episode of Simply Healed, and once again we have Dr. Jansen Calalan with us here this evening. Hi, Doc.
Hello, Shine. Hello, everyone. Happy to be here.
Happy to be here. Today's topic is about cervical cancer because the last few episodes, especially during the Q&A, there have been many questions coming from the audience, and they are cervical cases. So Doc, today we're going to talk about Pap smear. It's good that you're a doctor because we are both guys and we're talking about Pap smear, all right? So first of all, Doc, why is it important to detect cervical cancer? And what does it mean to have cervical cancer? How dangerous is it? What's its mortality rate?
The reason why we want women to undergo regular Pap smear tests is because cervical cancer actually is one of the cancers which has a very high mortality rate. So if we take an average from early stage, stage 1 cervical cancer up to stage 4 cervical cancer, the average mortality rate is 66%. So meaning 66 out of 100 women who get cervical cancer on average dies.
Wow.
Okay.
And even with successful treatment, even if you have a complete hysterectomy, the recurrence rate for cervical cancer is also very high. Right?
Yeah, it's also very high. It's at 22.3%. So approximately 1 out of 5 women will have recurrence.
Wow.
Okay. If we are able to detect cervical cancer very early on, so how much is the survival rate? It's actually, the 5-year survival rate is actually 92%.
That's a huge difference from 66% dying versus 92% surviving.
Yes,
day and night difference.
Yes, just because you detected it early.
Now, the question with the challenge with all cancer is it's very difficult to detect cancer early. In fact, most people who do detect cancer early is by a stroke of a blessing that they went in for something else and they found the tumor. But for cervical cancer and for Pap smear specifically, how effective is it in catching cervical cancer early?
Yeah, actually, it has a very high specificity and sensitivity rates.
So you can even catch it in stage 1, stage 2?
Yes, even in stage 0, we have
even in stage 0. Wow.
We have such a thing as a stage 0 cervical cancer.
Okay, if you ever find a stage 0 cervical cancer, it's like praise God, you probably dodge a bullet because you can definitely treat yourself. Probably 100% cancer success rate.
Also, this is one of the good news. If you detect a cervical cancer early on, patients who have cervical cancer stage 0 just needs excision biopsy. Excision biopsy is just just removing that area of the cervix which is which has the cancer.
Oh, so it's a very minor.
It's a very minor procedure.
Almost like burning off warts, like that,
exactly.
right? Yeah.
And you don't even need chemotherapy or radiation therapy for that matter.
Wow.
Okay, so that's how important early detection is, because you can really literally dodge a bullet.
You can dodge a bullet, right? Because if you don't detect it and you do have cervical cancer, then it's almost like a greater than 50 chance death sentence. But if you do detect it early, it's almost 100% cure rate, and you dodge a bullet. So what is Pap smear? Just for the guys who are watching, and maybe for the women who have not actually done any Pap smear in their life.
Okay, so a Pap smear test. So what is the goal of a Pap smear test? It's actually to get cells from the cervix.
Okay.
So take a look at this image. Okay, so doctors usually how does a Pap smear procedure begins? Okay, so a patient, a woman, lies on her back in the lithotomy position. So this is what a lithotomy position is.
Wow, we are learning medical terms again.
Now, so I know we have another term for this kind of position, but I'm not gonna mention it. So we stay medical. Okay? So this is how a Pap smear procedure is being done. Okay, so now the woman is in this position. Okay. Now we need to open up the vagina. So the doctor inserts a speculum to open it up. Now once the doctor opens the vagina up, the doctor will now try to visualize the cervix. So the cervix is a donut-shaped object. Okay. So take a look at this image again. So this is what the cervix looks like.
Oh, that's interesting.
So the doctor would have to be able to visualize this part. Okay, after the doctor visualizes it, the doctor now gets a brush and swabs the area, the middle part, okay?
Oh, okay.
The middle of the donut.
Center of the
center of the donut. So that is where usually, no, cervical cancer or cervical cancer cells are here. So the doctor gets a sample, then the doctor now sends the sample to the laboratory for testing. So we actually have a number of ways on to detect cervical cancers. So one is Pap smear, and another one is HPV testing. Okay, you can actually opt to do Pap smear alone, HPV testing alone, or both. Okay,
Which between HPV testing and Pap smear, which is the one that is better at detecting the cancer?
Actually it would be the HPV test.
Oh, okay, that would be
the more accurate one.
all right.
However, it would be more prudent for you to undergo both.
Okay.
Yeah, in case because sometimes, tests are imperfect. Okay, so it would be better for you to undergo both so that you can, the test results would be more accurate.
The difference between a Pap smear and an HPV test, how do you do an HPV test then?
HPV testing is just, running the samples in a PCR test.
Oh, so it's still the same procedure of getting the samples. You still have to be in that position. They still have to swab your donut.
Yes.
Oh, so
yeah.
Mine as well. You've already done the
Mine as well.
procedure.
Okay.
Mine as well. It's not okay. That makes sense. Doc, just for many viewers who have never done this before, what would the average cost be of having a Pap smear?
The Pap smear test is so cheap. I think it's around 150 to 200 pesos.
Okay, that is for US. But sorry, it's not.
So
yeah,
Philippine value.
yeah, for 400. Did you say 400 pesos?
150 to 200.
Okay, that
Around
is
that range.
like less than $4 US, right? So that is really no reason why. I'm gonna tell my wife this because I've been here with her the last 2 years in pandemic, so I'm very clear her schedule the last 2 years. She has not done a Pap smear, so I think we'll go and get it done. Doc, there's also right now even DIY Pap smears.
Yes.
So, but hearing from you about the procedure, I would guess that going to a doctor would still be better because how do you aim for the center of the donut?
Exactly. So I've seen these DIY pap tests, in a lot of e-commerce platforms.
Okay.
Now my stand on this is that
not that it doesn't work, but it might if you are doing it yourself, you might miss.
Exactly. Because even healthcare professionals, the cervix, if you are not experienced, okay, if you are just you are doing it the first
novice,
time.
yeah.
I mean, novices, medical students, medical interns,
even medical students,
even medical interns, medical students have difficulty visualizing the cervix.
Okay.
Okay. So if you are someone, a lay people who have no medical training whatsoever, and you are doing it blindly, guess what? Most likely you will miss it. Okay.
So back to why we want to do all these Pap smears to maybe even catch your cervical cancer at stage 0. So I think to catch your cervical cancer at stage 1, 2, or 0, you probably have to be very accurate because your cancer is so small. Of course, if your cancer is late stage, it's already more. It's not just a small area. So a DIY will work,
would make
but that defeats the purpose of why you want to do a Pap smear.
yes.
Catch it really early. So why don't you schedule? So now we know it's good to go and schedule with a doctor to do a Pap smear. Doc, how often should a woman schedule herself for Pap smears?
Okay, so how often is it? We have to divide this into 2 age groups. Okay?
Alright.
So the first age group would be so at what age would it be? At what age would it be? At the earliest that you should undergo Pap smear test. It's at age 21 years old.
21.
So 21 years old until 29 years old.
Okay.
Women should undergo Pap test every 3 years.
So those under 30. Every 3 years. Oh, easy to remember. 33 years. Yeah, okay.
So HPV testing alone can be considered for women who are aged 25 to 29.
But the Pap tests are still preferred.
Yes, Pap tests are still preferred. Now, for women aged 30 to 65 years, we have 3 options for testing. So number 1 is Pap test. and an HPV test. So co-testing every 5 years.
Okay.
So remember that. If you go for PAP test and HPV testing, that would be every 5 years. Okay? If you are going for Pap smear test alone, that would be every 3 years.
Which tells us like what you said, the HPV test would be more accurate.
Yes.
That's why HPV test
it's longer.
Is 5 years.
Okay. So also, if you are very uncomfortable to undergo PAP test, HPV testing, if you're doing HPV testing alone, that would be every 5 years as well. Okay.
But Doc, as you mentioned, right, the collecting of the samples is one procedure. The Pap smear test and the HPV is actually the laboratories doing it. So if you've gone already if you already collected the sample, there's no point. Don't save that $10-20, right? Just go and do it both, right? Now after you've started yourself on a schedule of testing every 3 years or every 5 years, when do you stop? Or is this a lifelong process all the way?
Okay. So of course at some point you have to stop screening. Okay, so the age where we stop screening is at age 65 years. Okay, but we have to fulfill a number of criteria. So number 1 would be if you do not have a history of moderate or severe abnormal cervical cells or cervical cancer, and if you have had either 3 negative PAP test results in a row, 2 negative HPV tests in a row, or 2 negative co-tests result in a row within the past 10 years, and the most recent test should have been performed within the past or 5 years, depending on the type of test. Okay, so if you fulfill everything, then you can stop undergoing PAP tests already.
So if you are age over 65, your last Pap smear or HPV test should be in the last 3 or 5 years, and it should be a consecutive one. So if you never ever took Pap smear test and you took one when you were 62, and now you are 66, you only fulfill one criteria, you have to go for one more because you need a consecutive negative, all right?
Correct.
Yeah, so it's like you do one test, they just want to make sure it's not a fluke or a mistake. So do 2 consecutive ones, and you're after 65, you are free. What about post-hysterectomy? What about those who do have cancer?
Now, for post-hysterectomy, so hysterectomy is actually the removal of the uterus. And if you are going to remove the uterus, the cervix goes along with it.
Okay.
So now, the question would be, I don't have a cervix.
Yeah, you don't have a
anymore.
cervix, so how do you test?
Should I still go for the PAP tests? Okay. So if you have had a history of cervical cancer or high-grade cervical cell changes, okay, you should still continue to have screening for 20 years after the time of your surgery. Otherwise, you don't have to undergo for Pap smear anymore.
So how do they test if there's no more cervix?
Yeah, they swab the cervical stump.
Oh, you still swab what is left over.
Yes.
All right, okay, so there you go. Doc, just to clear all the doubts and loose ends, 3 last questions. Why do we not test for cervical cancer before age 21? Why do we not test it annually, like every year? And is cervical cancer screening even required if I'm not having sex? For example, some ladies who have abstained from sex, either by age or by choice.
Yeah. So to answer the first question, why don't we test for cervical cancer before age 21? It's because cervical cancer cells at this age group, prior to 21 years, is very rare. And even if the women in this age group develop cervical, get cervical cancer cells, these cervical cancer cells, the immune system can fight off, and they turn normal anyway. Okay. So at this age group, you don't have to worry. Again, how does the body fight the cervical cancer off? Integrity of the immune system. Number 2, okay, inflammation. Okay, because HPV, when you get infected with HPV, for those
who are sexually
active, the body can still, fight off the inflammation and prevent the cervical cancer cells from from developing.
From developing.
Okay, so at this age group, no need for
So it's
for
good to be
testing.
young.
It's good to be young. However, once you step at or on age 21 years, then you have to begin testing already.
Now, the second question, why not yearly?
Why not yearly? It's because cervical cancer will not happen at least within the next 3 years.
Also, is the rate of growth of the cancer.
Yes, it's the rate of growth of the cancer. Now, this is across age groups, no, from 21 to 65 years. Okay, so and even if you do test annually, right, there will be false positive results that lead to a lot of tests, a lot of unnecessary tests. So that would bring up costs, that would bring you worries,
stress
stress you unneeded at that. Okay, so no need for annual PAP testing. Okay.
Doc, since we are on this topic, I think it'll be interesting for us to do another talk on simply the topic of the doubling time of cancer.
Yeah, that would be wonderful.
That would be interesting,
yes,
right?
interesting.
Like, why do your cancer cells suddenly from 4 centimeters become 8 centimeters, but for the last 6 years it was so small that it was not detected? I think that would be interesting for many people, especially cancer patients. And last question before we end, and I can see there are already questions coming in from our audience, and some of them are related not only to cervical cancer. Okay, the last one is, why is cervical cancer screening recommended even if I'm not having sex?
Okay, so to answer this, we have to understand how you get HPV and what are the factors that can increase your cervical cells' risk of becoming cancerous. Okay, so number one, how do you get HPV virus in the first place? It's through sexual intercourse. However, if you are not engaging in penetrative sex, then orally it can also be transferred.
Oh, okay.
Contact, it can also be transferred through contact. Although it's extremely rare, however, it can still happen.
It can still happen.
Okay. Now, of course, for the other risk factors, what are the lifestyle behaviors that can increase cervical cancer? What are the lifestyle behaviors that can increase the risk of cervical cancer infected with HPV to become cervical cancer cells? Okay. So that would be your smoking and being infected with HIV.
Where your immune system is compromised.
Yes. That is when your immune system is compromised already.
So smoking is usually associated with lung cancer and actually basically sets up your body in a negative state with inflammation and all that. But specifically, it actually raises your risk of developing cervical cancer from your HPV infection. So another reason for us not to smoke. Doc, again, one last question, which I almost forgot to add, which is so obvious also. You always talked about getting vaccinated for cervical cancer. So there is HPV vaccination. If you are vaccinated, do you still need to go for all these testing?
My stand on this is yes. Okay, so why is it so? Because getting vaccinated with the HPV vaccine, okay, you only get immune against the strains that are contained in the HPV vaccine. The good news here is the manufacturers, the scientists, the researchers that create the HPV vaccine, the strains that they put in there are the most common HPV strains that causes cervical cancer. So if you receive HPV vaccine, okay, at least 90% or at least 95% you would already be immune against cervical cancer. However, the remaining percentage, okay, you can still get it from other HPV strains, rarer HPV strains, or if the HPV virus mutates, then in the chances that you are not immune against that mutated strain or that other strain, then you can still develop cervical cancer. So it would still be better to do screening.
I mean, it's just like if you got COVID vaccine, doesn't mean that when you're having a flu or whatever, you don't test yourself for COVID, right? Yes. Because there's still a chance that you might have actually caught it. And again, the reason is if you catch your cervical cancer in the early stages, it's it's just like an inconvenience because you can actually just treat it and it will go away. You literally dodge a bullet, save your life. So there's no reason not to.
Yes.
In short, Doc, having a yearly annual medical checkup is a good habit.
Yes,
because on every 5 years you include the Pap smear in your medical checkup. But it's like a regular thing. You don't feel it's a hassle. You don't forget. So doing an annual checkup is a good idea.
Yeah, it is. However, please don't get the wrong idea, okay? Having an annual checkup is, we may think it, proactive because we are doing annual checkups. However, that is not active enough. Okay, that is not proactive enough.
Wow, I'm glad you say this because I think some people will say, "Oh, my annual medical checkup is clear. I can continue with my life as it is."
That's what I mean.
Oh, that's what you mean.
That's what I mean, okay? Because if you are just undergoing the annual checkups, the annual screening, then you are just looking. You're not doing anything to prevent it from happening in the first place. Okay, so what are the things that you need to do to prevent it from happening? So stop engaging from promiscuous activities, sexual activities. Okay, so that's number one, to prevent cervical cancer. Number two, always eat a predominantly plant-based diet. Okay. And number three, if it's so difficult for you to eat a predominantly plant-based diet, there are supplements like Simply Nature PPARs, which is made out of a very special strain of microalgae that can help boost up your immune system to fight these infections that causes cancer, right?
Yes.
Because studies have already shown that. Why am I so always recommending this? Because Simply Nature PPARs, they have tested their products against the immune system and saw its effect on the immune system, and they've shown that dendritic cells, which are scouts that gets all the infectious diseases.
Not just cancer. All infectious diseases.
So dendritic cells are antigen presenting cells. So the main job of these cells is to detect infection, detect cancer cells, and present them to the immune system so that the immune system can go and kill them off. Okay.
And of course, when I first met Doc Jansen, wow, how many years is it now? 4 or 5 years?
4 or 5 years.
Yes, and in that in between time, so many patients. So there's a difference between the theoretical knowledge and now when I talk to Doc Jansen and when we discuss about PPAP protocols, his confidence level and comfort is so different because once we see it in actual patients, and your own patients, it's a very big difference. So without further ado, Doc, let's move to the Ask Me Anything segment.
Hi everybody, good evening, and first of all, Happy New Year to you all. You are watching another episode of Simply a Webinar brought to you by Simply Nature, your long-time running healthcare awareness webinar here in social media. You are now watching our topic for tonight is, do I need to go to the clinic or do DIY Pap smear? This is a very interesting topic, and this has been very much discussed tonight by our two gentlemen who will be answering our questions for tonight. So without further ado, I'd like to call on our PPARs expert from Singapore and CEO of Simply Nature, Mr. Sean Lim, and of course, our lifestyle medicine doctor, Dr. Jansen Calalan. Good evening, Sir Sean. Good evening, Dr. Jansen. Happy New Year.
Happy New Year, Sheila, and Happy New Year to all our viewers. We are so glad that you join us on the first week of January. Doc Jansen, so good to see you in 2023.
Hello, Sean. Hello, Sheila. Hello, everyone, and a Happy New Year to everyone. I hope you have had a wonderful holidays. No?
Yeah, we had many long weekends.
Yes, and you feel refreshed for 2023.
Yeah, we're very excited. Doc Jansen and I have been talking about new formats for the health talk. We were thinking of increasing, maybe doing some programs that are just basically pure AMA, so that because we know everybody enjoys asking questions, and some of our Ask Me Anything segments are so lively because even viewers are contributing points and affirming some comments. So we are looking into that. So over the next 2 weeks in January, to especially, I want to greet all our regular viewers, Lily, Raymond, and all the ones that we always see. we would really be doing some surveys in a way so that you can give us feedback, because we want 2023 to be really exciting. So we really want to shake up our format and make it something more engaging for everyone this year, right? So Doc, looking forward to doing that.
Yes, thank you so much. All right, so for the first question for our first webinar of 2023, coming from Ms. Lilibeth, Doc, is having irregular mens, can it trigger cervical cancer?
No. Having irregular menstruation means that there are some hormonal imbalances happening inside the woman's body. Okay, so what are the reasons of these hormonal imbalances? There are numerous. Okay, it might be congenital, it can be lifestyle related, it can be autoimmune in nature as well, no? But with cervical cancer, remember the main reason of getting cervical cancer is number one, infection. Okay, so HPV infection. Okay, so that's the number one. That's the key thing. Okay. However, can cervical cancer manifest as irregular menstruation? Yes. Okay, because if you have cervical cancer, you have a tumor in that area. No, so if you have a tumor there, it can bleed. So if it can bleed, then it can happen anytime during a month's time. No, so it can happen in between your menstruation. You can during your menstruation, it can be more. It can be heavier. Okay, so with this, that's the intersection of or the parallelism of these things. Okay.
So just to echo out what you said, it cannot trigger, or the irregular period cannot trigger, but it can be a manifestation.
So it could be a symptom of cervical cancer. All right.
All right. For the next question, now this was sent to us privately by Ms. Nini. Is soft gel used for anti-cancer? Can soft gel be used as anti-cancer as well?
I can answer that. Yes, it can. Now, normally, if you are totally already in remission, or you are a healthy person who just wants an anti-cancer protocol, then the tablets are really fine, right? The tablets are really fine. The benefits of just the tablets alone is that all metabolic syndromes, so we are talking about high blood sugar, which is diabetes, blood cholesterol, hypertension, chronic inflammation, gout, even light immunodeficiencies like mild lupus and things like that. Just being on the tablet itself can have a therapeutic healing effect for all these syndromes, and of course it keeps your immune system up, lowers your inflammation, and is basically anti-cancer in this aspect. Now, why would you move up to soft gel? That is more like Lily asked this question. So I think I'll use the Asian practice. Lily, I think it's easy to understand that sometimes as Chinese, we would go and eat bird's nest, right? It's not that we eat bird's nest every day because number one, it's expensive, right? So we will 家暴, right? 吃补, right? So that could be your approach. That would be why a normal healthy person would even consider to take the soft gels. You felt maybe under the weather a little bit, or you feel, oh, I saw a few wrinkles coming out. You just thought that your health needed tuning and you wanted something more potent. And that's what we usually do when we go and buy ginseng, when we go and take bird's nest. So the soft gels are like that. You use that if you're perfectly healthy. You may be taking soft gel simply because you just want an extra boost. Now, there are very real reasons why you do take soft gel. For example, you have eczema, psoriasis. It's not so serious that you need to take the extracts. Okay, it's also very good for cancer patients who just finished their chemotherapy, and they graduate down slowly from the extract down to the soft gel before they go down to tablets. And once in a while, they might want to routinely just do a week of soft gel, like a fine tuning, or when you maintain a car, you go and change your motor oil. Okay, because that's soft gels are very affordable compared to using an extract to give you that occasional boost. right? So again, those with more serious metabolic syndromes, like you got quite serious high blood cholesterol, high blood sugar, then you will actually want to use a soft gel so that you bring that under control until you are normalized, and then you use the tablets to maintain. So I hope that helps answers Lily's question. Yeah.
Thank you, Sir Fine. Okay, another question coming from Miss Arlene Almakar. Can a 50-year-old female still have HPV vaccine?
Yes, absolutely. No, there's no harm in a 50-year-old getting an HPV vaccine. Okay, so you can. However, here's the thing: would you still have the benefit of getting an HPV vaccine? Of course, you still can. However, the question there is how beneficial would it still be? Okay. The thing is, at that age group, the HPV vaccine was not studied, so I cannot tell you a specific number on how effective it will be. And of course, another thing, no, considering that HPV virus triggering cervical cancer usually happens in a earlier age group, or actually in the middle age group, not in the young, no, but around in the middle. Okay, so getting an HPV vaccine at this point in time, even if you are infected with the HPV virus, you developing cervical cancer might not happen in your lifetime even. Okay, so but nonetheless, of course, at the back of your mind, hey, what if it happens? No? So you don't want that. So that's the reason why you are considering getting vaccinated with HPV. So at this point, if I were you, I'd still get it. Okay, even if it gives me a lesser chance of benefit. I mean, it's still a small chance. I mean, yeah. Okay, so I'd still get it, right? So
thank you.
Yeah. Basically, there's no downside.
Yeah, there's no downside.
There's no downside. I think that's the important aspect. And you know, you never know. At 50, you might still be active. So it's still good to be protected. Yes.
Good point. All right. Thank you, Sir Fan. Thank you, Doc Jansen. All right, for the next question that we have, okay. Do I still need to do Pap smear even if I'm already menopaused? Coming from Miss Jane.
Yes.
Oh.
Remember the age group? Yeah. You would still need to do Pap smear even if you have finished menopause already, because it goes through senior years, right? So even if you are already menopause, yes, you should still continue getting your Pap smear until such a time that it makes no sense anymore. So that's around 65 years old. Yeah, beyond 65 years, no need to get Pap smear anymore. Okay.
Okay. Thank you, sir. Thank you, Doc Jansen. Okay, another question sent to us privately. This is interesting. Will I have? Is it possible for me to have cervical cancer if my husband has prostate cancer?
No. Okay. Prostate cancer and cervical cancer are different diseases. Their cause is also very different. Okay. So again, you getting cervical cancer, the main reason is a virus infecting you. Okay. For prostate cancer, it's not a virus. The reason why men get prostate cancer, the number one reason is lifestyle. Okay, because men, being men, you know, we love to eat our steak, we love to eat junk foods, drink alcohol, we smoke, right? So these things can increase our risk of getting prostate cancer. The secondary one would be family history already. Okay, but nevertheless, even if you have a family history of prostate cancer, it's not 100% that you yourself will get prostate cancer, as long as you live healthily, or if your lifestyle is healthy. Okay, so different causes. Okay,
but I think this question might have been based off the fact that cervical cancer can actually be transmitted because of sexual intimacy,
yes,
right?
Sexual intimacy.
So your husband having prostate cancer doesn't mean he doesn't have the virus that can give you cervical cancer. So that one is definitely out. It's not related.
Thank you, Sir Sean. Thank you, Doc Jansen. Another question coming from Miss Kyra. Can contraceptive pills protect me from cervical cancer?
Unfortunately, no. Okay? The only way for you...
What about condoms?
Yes,
condoms yes. But
okay.
Contraceptive pills, no.
Contraceptive pills, no.
Okay.
Remember, cervical cancer is, you get cervical cancer because you get an HPV infection. So this is a virus. Okay? So, cervical cancer or HPV infection is usually sexually transmitted. Okay? So, promiscuity, having multiple sexual partners would be a risk factor for getting cervical cancer. Another one would be an early age of sexual activity. Okay, very early age. So usually that would be teens. Okay, in the teenage years, and in some cases, some unfortunate cases, even pre-teens. Okay, for some, for very unfortunate cases, they still can. However, again, in the lecture, right, at this age group, during the teenage years, even if you get infected at that point, it's very uncommon for you to develop cervical cancer still because you're still very young. However, as you near adulthood, as you near the age of 18, if you get very sexually active, that's the time when this risk or when this probability significantly increases. Okay, so that's the reason why it becomes a risk factor. Okay, so what else? What else? So oral. So it's not just penetrative sex; it can be transmitted orally as well.
Wow.
Yeah.
Even oral sex can.
It's because HPV. What does HPV mean? HPV means human papilloma virus. Okay, the human papilloma virus can also be can also infect the oral mucosa.
Okay.
So if you do oral sex on somebody else who is infected with HPV, then the one performing the act can also get infected. However, it's in the person's mouth. Okay, so this person being sexually very having had multiple partners, the person if the person does it on another person, he or she can pass it to that person as well. And of course, you can that person who received it can develop cancer as well. Okay, cervical cancer if it's a woman. If it's a man, penile cancer. Okay?
Penile cancer.
Yes, penile cancer. The number one cause is also HPV.
Oh wow! Okay, so I didn't know this. This is new. This suddenly I'm awake.
Imagine your second head having a third head.
Oh wow, that's just very scary.
Oh.
Okay, but to all our viewers, I think one application of tonight's program is that you educate your children. Right? I can see from the response, some of us are even grandmas, lolas, or grandpas. So you could always advise your children to have your grandchildren vaccinated. Because until I met Dr. Jansen, I never knew there was this thing because you don't talk to your girlfriend or your wife about cervical cancer, right? And I didn't know that it was spread through sexual proximity, intimacy. And nowadays kids, they're different generation from the older generation. So this is something that you may try and lock them up, but they will find a way to do what they want to do. So I think this is something worth considering, and that will be your takeaway from this program, that you can vaccinate your loved ones from this unnecessary cancer.
Yes.
Yeah, Lily is just saying, she's 68, she's still doing her Pap smear during her annual medical checkup. She just wants a peace of mind.
You should graduate already. I mean, come on, if it has been negative for so long, right?
That's fun. Thank you, Lily. Yeah.
Thank you. So therefore, Doc Jansen, the pills are purely for just protection
Yes,
not to get pregnant.
Yeah,
That's
so the
it.
contraceptive pills.
Yes.
Yes.
And of course, there are other medically medical indications as well for oral contraceptive pills. No, so it's not just to prevent you from getting pregnant. So women with PCOS, polycystic ovarian syndrome, need oral contraceptive pills as well. Okay. So,
Thank you, Dr. Nelson. Thank you, Sir Sean. The
All
other
right.
question coming from Miss Emmy. Does the number of kids now increase the risk of cervical cancer?
No. Okay. Here's the thing, no. The number of kids doesn't, if you have only one sexual partner. Yeah.
Okay.
If you have multiple kids from different partners, then it would be a risk factor. But again, this is a risk factor. It's a probability. It's association.
It doesn't
It's not
cause.
okay?
It doesn't
It's
cause.
It's not a cause and effect. Okay.
Okay.
There's a difference. Okay. So why is it association?
Mm.
So again, having multiple sexual partners is a risk factor. Why? Because you increase your chance of acquiring the HPV virus because you have multiple sexual partners. Okay?
Mm.
But if it's only one partner, then this partner of yours is also clean. There's no chance for you to get HPV.
Okay, that's great. So one of the benefits of being monogamous is your risk of getting cervical cancer via the virus is 0.
Yes.
So another good reason to stay true to your partner, I guess. Yeah.
Yeah, it's just financial risk if you have many kids, okay? There you go. Okay, another question coming from Miss Ashley. What's the difference between pelvic exam and PAP test?
Oh, okay. A pelvic exam is a physical exam procedure that the doctor performs on the patient. Okay, so what happens is the doctor would have to, of course, examine first, then try to insert, usually insert 2 fingers up the vaginal canal to palpate or to feel the cervix, the surrounding areas, and yeah, if there are any masses. So that is in general, that is how a pelvic exam is being performed. Okay, a Pap smear is different. Okay, so as you have seen during the lecture a while ago, when you do a Pap test, okay, so you first, of course, you examine first, then you insert the speculum. So instead of inserting your finger, you insert the speculum. So if you do not know what a speculum looks like, Google it. Okay, so once you insert the speculum, you open up the instrument.
Canal.
So you open up the vaginal canal, then you try to locate the cervix. Once you have located the cervix, okay, so the cervix is a donut-shaped object. Okay, once you have located that, then you begin, again, you inspect. Okay, if it's normal looking, so it's pink, it's regular in shape, so there's no structural abnormality, there's no wound, there's no ulcerations. Okay, there's nothing white that's on it or coming out of it, then you can perform the swab already. So when you perform the swab, so just do it gently, then retrieve the swab, then put it on a slide, prepare it, put it on a slide, then send it to the laboratory. Then that's it. Remove the speculum, finished, done. So all this procedure can be finished in around 5 minutes actually. Okay, even less if the doctor is really very experienced. Okay, yeah, so that's the difference.
So a pelvic examination, what do pelvic examinations achieve? I mean, we know Pap smear is to check for HPV infection.
Yes.
So what does pelvic examinations usually achieve?
Pelvic examinations usually, if you try to palpate if there is a mass, so you try to feel the mass.
Oh, okay.
Yeah, that's one thing. You can also, by doing a pelvic exam, you can actually estimate the size of the mass by just using your fingers.
Okay? So it's really a physical exam.
Yeah, it's really a physical exam. And okay, this is how it. So imagine, woman is in front, right? In that position. So the doctor inserts two fingers inside the vaginal canal. Once the doctor inserts, the doctor can now feel the surrounding area. Okay, are there any masses? Is there pain? Is the patient reacting to pain? Are there any discharge? Okay, so basically that's how. But usually pelvic exams is more on it's performed on pregnant women. Okay, and that's where the pelvic exam is really useful, especially if the patient is already in labor and you are trying to gauge if the baby is gonna come out already. But for women who are not pregnant, I mean, unless you have a tumor, complaining of a tumor or something, then the doctor might perform the pelvic exam then and there. But if you're not complaining of anything, then we don't usually do that, okay, routinely. Okay.
All right.
Thank you, Doc. Thank you. Very interesting topic. Most especially, I know that a lot of ladies are watching right now. Me myself, I'm really learning a lot. Thank you, Doc Spencer. Okay, another question coming from is Ashley again. Can douche protect me from cervical cancer?
No.
Oh no.
It can actually even promote yes.
Oh?
Because a douche, if that's, but it's gross. No? If you reuse that or by mistake you use somebody else's douche, I mean that's kind of gross. But it's one way for you to get infected. And another thing is if that douche seems to be clean,
but
was
it's not contaminated somehow.
Contaminated somehow, touched physically in contact with a person who has infected with HPV, then you can contract the virus when you use the douche.
Doc, I know you're not an OB-GYN, but
sorry, Doc.
And also I have no idea how I chanced upon it because I'm a guy. But I think maybe reading through medical stuff, I've come to articles that say like douching is basically not a good practice.
Yes, actually.
Okay, I just wanted to throw that out there. Because I remember reading somewhere, douching is not a good medical practice. That modern doctors don't encourage the practice of douching.
Yeah, because one thing it can promote infections.
Promote infections, right?
Yes. And you do not want this kind of infection happen to you.
And because of AD Pro, those of you who are aware or have used AD Pro from Simply Nature, I had to do the research on it, and part of the research is understanding biotic fauna in the women's reproductive area, and maintaining the right acidity, maintaining the right bacteria balance is actually very important to a woman's health. And this is actually even part of a fertility protocols. That means if you have difficulty getting pregnant and you want to get pregnant, one of the thing is restoring the condition of your reproductive area to the correct bacteria fauna. And actually, I think the practice in Philippines of feminine wash is actually very terrible too, because if your feminine wash changes the pH or kills or sterilizes the bottom that area, it changes the natural bacteria count, the good bacteria, and it could affect even your fertility. So when I first came to the Philippines, I was surprised. Just for our listeners, Filipino listeners, if you go to Singapore, you cannot find feminine wash. You go to all the Guardian Pharmacy or the equivalent of Mercury, there is no such thing as feminine wash in Singapore. So that was something new to me when I first came, and since we are on this topic, I just wanted to throw it out. Doc, do you have any comment about this one?
Actually, in mid-school, using feminine wash was not actually
taught at all, right?
Taught at all.
Yeah, so it's like a commercial product, like they commercialize Christmas. It's not a medical practice. It's not even something that was really encouraged. Because you don't really want to change the natural.
I mean, feminine wash has been around for.
Yeah, but again, if you go to Taiwan, you go to any other country in Asia, I'm sure even in Japan, there's no such thing as feminine wash. So it's very interesting. So, and I know many of our listeners are Filipinos, and you might be having a practice of doing that. I'm just highlighting, it's really not good. It's really not good to mess with the natural, what's that called, balance in your reproductive organs.
Yeah.
Okay?
Feminine wash was started.
Doc Jansen's researching now.
Researching, yeah. I'm
Thank
trying
you,
to
Doc.
search in Google. Feminine wash, 1924. Around that.
Oh, that
yeah,
long?
around that decade, but it's not really feminine wash nowadays. It's a different.
Yeah.
It's basically disinfectants.
Yeah, this is terrible. You don't want to disinfect your. No, you don't want to, because how your body keeps healthy and infection free is actually the bacteria that grows there, the good bacteria that grows there, helps manage and prevent yourself from getting infected. Now, if you do feminine wash, you sort of clean everything, but you leave your genitalia unprotected. And it's just like real life. Bad guys always move in faster than good guys. So when you kill all the bacteria, there's a high risk that the bad bacteria actually grow instead of the good one. And then it results in you being dependent on the feminine wash to artificially keep your genitalia area clean. But the body has a natural way of keeping the right pH, right? So that's just something for all the ladies. And I know tonight we have many ladies, and this is a cultural, unique practice. Nowhere in Southeast Asia do people use feminine wash. Yeah.
I'm just curious. How about, is it the same mechanism with deodorants?
Oh, deodorants. Yeah. I think people are really moving away from deodorants because it's... Doc, I mean, since we're on this topic, that's where your glands are, and that's where your pheromones are produced, and we're putting chemicals there, and we're blocking it. I always thought Imodium, or what is the substitute to Imodium in the Philippines? When you get LBM?
Yes.
The whole concept is a bit weird. You took something poisonous, your body's trying to throw it out, you take a pill to keep it in because it affects your, what's that called, your work and everything, right? But it's actually, if you think about it, just like when you get food poisoning, after you vomit out, you feel so much comfortable because the poison is removed. But imagine you try to keep it in you and let your body go and fight the poison. So again, I think when we talk about deodorant, it seems counterintuitive as well. Your body wants to sweat, right? Your glands there are put there for a function, and then you want to clog it up and you want to stop that process. So, yeah, Doc, what do you think?
Well, there are a lot of controversial things with the use of deodorants, right? But of course, it's chemicals. So at the back of your mind,
yeah, you're putting your chemicals at the place where your glands are. Yeah, that's just not.
Yeah.
But maybe on your very, very important date, okay, you're using it once, yeah, okay. But after that, on a daily use, no,
But I guess, well, we're in a tropical country. And we need it, especially if we are meeting somebody
special.
Somebody special. I mean, you're in the office. I mean, you don't want anyone looking at you weirdly, right?
Yeah.
Yeah, because they smell something. So I guess in that respect, yeah, you can use it, but of course you need to have days where you don't use it at all.
That's a good advice. There should be days so that you give your body, your glands, a chance to breathe.
Yeah, just chance to breathe. Yeah. And of course, to give them a chance to breathe, right? In this concept, exercise.
Oh yeah.
Yeah, sweat it out.
Sweat it out.
Just go on it. Because if you exercise, no matter how much antiperspirant you use,
it will beat the antiperspirant.
You're gonna sweat. Okay, so.
Of course, it doesn't need to be said, but you shouldn't wear deodorant to sleep.
Yeah, of course.
All right.
Of course.
Okay. All right.
Thank you, Doc. Thank you, Senpai.
Right.
Okay, another question from Mr. Bien Almendros. Is using public toilet could be a risk of getting HPV
could you actually
virus?
get HPV from? Okay.
No.
It has to enter.
It has to enter. Okay, using public toilet because at the back of your mind, right, you're gonna sit on the toilet.
Yeah, then you sit. What if the person who before you has HPV virus?
No, you won't. Number one.
Okay.
It's so far. I mean, unless you are.
What if you are so unlucky? The splash goes up your.
Even the
splash.
You're gonna wipe it off.
Okay.
Okay. However, yeah. Can HPV virus be transmitted through fomites only if you insert?
Okay.
Means instrumentation. So I think you get the picture.
Okay, so it has to be inserted
Yeah, it has to be
into your
inserted.
canal in order for for you to get infected.
You know, if you just use the public toilet, I mean, you're gonna sit there. It's either you're gonna pee or you're gonna poop, right? The place where you're sitting at is so far from the port of entry.
Okay. From the port of entry, I like that.
Not unless you're doing something weird.
Okay. So don't do anything weird in public toilets. Okay. Yeah, but it's not going. You're not gonna accidentally catch HPV virus and then cervical cancer from use of public toilets. All right. That's a very practical and real question, you know, because especially when we hear a program about this and we didn't know, we will start to wonder, you know, all these questions. Yeah.
It's still a good question. Thank you, Mr. Bien. Okay, another question coming from Ms. Pinay Bayan, one of our avid viewers. Do women beyond their teen years still need to get cervical vaccine?
Yes, of course.
Because they are more active also.
Yes. The age group is between 9 and 45 years old.
9 and 45.
Okay, that's the age group.
Okay. Just a follow up coming from Ms. Lilibet, can a teenager have cervical cancer, or is it just the days or the period to acquire that?
Can a teenager develop cervical cancer? It's very rare. If we have cases, it's very rare. Usually, when a teenager that is very sexually active or very sexually promiscuous, once this person gets cervical cancer, it's usually in the 20s already.
Okay, so not in the teens.
Yes, not in the teens.
So again, very I have a niece, so now I'll remind, just so that again, to all the viewers here, this is still applicable because you have loved ones, your niece, your daughter, or your grandchildren. And like I say, culturally, things have changed from the olden days. It seems like getting this to be vaccinated against cervical cancer is just practical.
Yes, and there are also new things that are coming out, just like what
again, it doesn't mean that your loved one is as active. By the luck of the draw, if their husband has been active, even though they have never been active, by the luck of the draw, the husband could be the one that infect them, right? So they could have been pure and abstained, but if the man that they fall in love with had a history, so again, this is a cancer that can be avoided, so why not?
Yes. Thank you, Sir Sean. Thank you, Doc Jansen. Another question coming from Miss Bria. Can I still get pregnant if I have cervical cancer?
Yes, you can still get pregnant. Yep. Unless the tumor is so big that it already disrupts the port of entry of the sperm. However, if the cervical cancer is still so small, you can still get pregnant. Can you bring your baby to term? Yes. Can you give a normal childbirth? Yes. But depends on how big the tumor is. If the tumor is microscopic, if it's so small, you can. But if it's so big,
cesarean then. If you manage to carry the child,
yes, cesarean, definitely. So yeah. Another question: can the tumor metastasize to the baby?
Oh yeah, can the cancer spread to the baby? The answer is no.
It can, because why? There's a I forgot the medical term. There's this sac that wraps around the baby. So it's the
It protects the
water that you
Embryonic.
yeah, my water broke, so that is the sac.
Yeah.
Okay, so the baby won't be able to get the cervical cancer from the mom. Okay.
Well, I think that will put that will give peace to a lot of people who are in that particular condition, and mothers would worry if they pass something to their kids, right? So that won't happen. Yeah.
Thank you. That's good news. Okay, another question coming from coming from Miss Leila. How about tampons or napkins? Can they protect someone from cervical cancer?
No. Tampons, yeah, because if using tampons, again you insert. If you by any chance, again it's gross. I mean, by any chance, the tampon that you use was contaminated by a HPV virus. Someone touched it, someone used it, and you mistakenly use it. I mean, no, it's so gross. I mean, in that way you can get infected. It's similar to instrumentation, okay? Because you insert the tampon, right? The other one, what's the other one?
Sanitary napkin.
Sanitary napkin. For sanitary napkin, again, yes, you can get infected with HPV.
Oh,
okay.
If the sanitary napkin is infected.
Yes, again, if it is contaminated. If it's not contaminated, then.
But it's on the outside, different from the douching and the tampon.
Yeah, you can get genital warts though.
Oh, you can
genital warts is also the main cause of genital warts is also HPV virus.
No, I just again take the opportunity because I'm curious as well as a guy. These three options that women have: douching, tampon, and sanitary napkins. Again, I remember, I think it's in the same article that the sanitary napkin is the best option because you don't insert anything into your canal.
Yes.
All right. So just for the ladies out there, I ask on your behalf. All right, which is weird as a guy, but maybe that means the choice of sanitary products between a tampon, napkin, and douching. The napkin is you don't insert anything into yourself, so in that sense it avoids a certain risk of any type of infection, not just HPV.
It's a good thing it's not common here in Asia or in the Philippines.
Yeah, actually, in Asia, not very common to use tampons. Yeah.
All right. Thank you, Sir Sean. Thank you, Dr. Jansen. Another question coming from Miss Arlene from Al-Makar. Are those who have PCOS can still get a chance to get pregnant?
Yes. I actually personally know some friends of mine who have PCOS and got pregnant. Yeah, it's really got pregnant. However, the probability leans on the more difficult one. Okay, if you have PCOS, it can make it more difficult for you to get pregnant. Okay, because of the hormonal imbalances. So if you do get pregnant, if you have a PCOS in the first place, then that kid is really
miracle kid.
Miracle kid, actually. Yeah.
Just related to this question, one of the top endocrinologists in Philippines, I won't mention his name because I don't have his permission, but he was actually sharing at one of our conferences. He actually uses soft gel capsules in his protocols for PCOS, and he stood up during a conference to verify that it is very, very effective for the treatment of PCOS using soft gel capsules and tablets. So this is actually coming from one of the top internal medicine endocrinologists. Correct. So related to this question, so if you have PCOS, first of all, and you want to get pregnant, get rid of the PCOS. So there is successful protocols that you can do, and we have doctors who have great experience with that. And you can always do a consult with Doc Jansen.
It's a good way to go around it, rather than
right. You get rid of the PCOS, then you can have higher chance of having pregnancy and less complications as well. Yeah.
Yes. Thank you, Sir Sean. Okay, another question.
Hi, Bill. Hi, Nathan. Just wanted to say hi.
Hi, Sir Nathan Bill. Okay. Another question coming from Miss Anna. Can PPARs help in conceiving? If yes, how?
Oh.
Yeah. Now, why is it difficult for you to conceive? That question must be answered first. Okay? if the reason is metabolic, if the reason is PCOS, then PPARs can help you conceive. Okay, but if the reason why it's very difficult for you to conceive is because your partner, the husband, somehow sperm's not working, quality of the sperm's not good. There are certain problems with the ejaculation. Then
then
it won't. Okay. Structurally, if there are structural problems, I mean, there are certain cases where the vaginal canal does not lead to the uterus, or you have two vaginal canals, you have two cervices, you have two uterus, then yeah, if that's the case, then no. Okay, so the root cause should be known first before we can say that if PPARs can help. Yes, PPARs cannot. Yeah.
So go for a consult. And on this part, one of the directors in Simply Nature Singapore, her family is actually a direct testimony for this. Her sister is her sister only has 1 or 2 periods a year. So obviously, if you only have 1 or 2 periods a year, conceiving a child is a very difficult process. So they were married for 10 years, and they were married really young, I think 20 or something like that. Really young. So this is childhood sweethearts, right? And they've been married for a long time. They couldn't have kids. So they actually took the PEPA extract powder, and after I think 6 months to 9 months, her period normalized. Now she has 3 kids. Now she has 3 kids. So again, as Doc Jansen explained, depend on the cause. So obviously the cause in this case was very obvious. The lady had some hormonal issues. Her menstruation was irregular. So after taking the PEPA extract powder, it became regular, and that allowed her to conceive. Okay, so again, case by case basis, but at least hearing that there are people who were able to solve their issues of not being able to conceive. I hope that gives you hope so that you can explore and see if PEPA protocols would help you to make that dream come true.
Thank you. Very encouraging. Thank you, sir. Thank you, Dr. Jansen. Another question from okay, what's the next step after getting abnormal Pap smear?
Okay, so
wow, that's a good question.
Yeah, what's the next step after you get an abnormal Pap smear? So the next one would be to know if the abnormal Pap test is significant. Okay, because sometimes, or most of the time, even if the result is abnormal, it's not significant enough for us to do something. There's just some inflammation. There's these abnormal looking cells, which we can it happens. Okay, basically it happens. Now, when the diagnosis is different, when it's malignant, if it's cancer, then the next thing that we need to do is to do a biopsy to confirm if it is really cancer already. Okay, so if you do a biopsy, so now the doctor would inspect the cervix. Okay, here's the thing: can this thing be removed en bloc? Okay, so meaning en bloc, can I remove the entire thing in one go? Is it small enough that I can remove it? If not, then I'll just get a little, then send it to the laboratory to confirm what kind of tumor is this. Is it really cervical cancer or is it something else? Okay, if it's really cervical cancer, next thing that we need to do is to do the staging. Okay, to do the staging, we need scans. Okay, so CT scan, ultrasound would do. Okay, now the next thing there would be, if we already know the staging, then for every stage, for every cervical cancer stage, there's an appropriate management that we need to do. Most of the time, it's chemotherapy and radiation therapy. Okay, can hormone therapy work for cervical cancer? No. Can immunotherapy work for cervical cancer? No. At least there's no immunotherapy drug yet that was discovered to treat cervical cancer. Okay. Will surgery work? Yes, but depends on the stage. Okay, if it's stage 4, more advanced stage like stage 3, stage 4, probably no. Okay, because it's already very advanced. Okay, so if it's in early stage like stage 1, yes, probably yes. Remove everything. No? Usually tabiso is what doctors do. No? So total abdominal hysterectomy with bilateral salpingo-oophorectomy. So medical term, to basically remove everything, both ovaries, the fallopian tubes, the uterus. Okay, so those are removed. Okay, so those are some of the options that you can consider once you get diagnosed that okay, it's really confirmed already.
Doc, your last statement of the totally everything removed sounds so scary. So I just want to change the tone a little. Okay, number one, that if you discover it early, there are many treatment options. Okay, chemotherapy is one of them. If you hear chemotherapy in our program, especially long-time listeners, you will be smiling because you know you're not afraid of chemotherapy because we have the PAP protocol that protects you from the negative side effects of chemotherapy. And so you can go through chemotherapy without worrying that chemotherapy will actually kill you. Okay? Because a lot of time people are afraid of cancer because it's like, oh no, I have cancer. Cancer will kill me. If I go for the treatment, which is chemotherapy, the chemotherapy will kill me. It's like both ways I face death. Well, the good news now is with the PAP protocols, chemotherapy is very, very safe and very, very effective, and we can protect you and prevent recurrence. And also, in the case of cervical cancer, immunotherapy is not available yet. So I hope this is very encouraging that we can tell you right now, we can help manage all the side effects of chemotherapy or majority of them so that your experience will be a positive one. Okay? So again, positive note, because that was pretty scary when you one that you ended on. But it's the truth. It's the truth. All right.
To give you to make you feel a little bit better, the surgical procedure that I mentioned, although it's a major surgery, there are a lot of things that the doctor would remove from your body. I've assisted a lot of this kind of procedure when I was still a student. But so far, on every procedure that my attending doctor does, the blood loss is really very minimal.
Okay.
Usually it's just 10 ml.
Oh, 10 ml is just like this.
Yeah.
Such a major surgery, and that's the only blood loss.
Yeah, because we already have so advanced medical techniques. So blood loss is really very minimal. The time that the patient is inside the hospital usually ranges to 2 to 3 days.
2 to 3 days. Oh, that doesn't sound so bad.
3 days is quite long already, to be honest.
Oh wow. Okay.
So yeah.
All right. So, like I said, you can treat the cancer, and that's always good news.
Definitely. Thank you, sir. Thank you, Doc Jansen. Okay, all right. Another question coming from Ms. Charlotte. What's the equivalent of Pap smear for men?
Oh, there's none.
There's none.
Because we do not have a cervix.
Oh, we don't have a cervix. Okay.
Yeah.
All right.
Well, okay. If you're asking, how do we know that something's wrong? Usually, the appearance changes already.
For the guys, it's simple because our organ is on the outside.
We can see.
We can see. All right, we can see.
Right then and there, if the head is developing another head, oh my goodness.
You know, it's very interesting that when I watched the documentary where they graphically show how a baby develops, it's the female reproductive organ is literally like the male penis pushed in. It's like a reverse. Yeah, so there is the place where the male's reproductive organ, the head, is actually inside. That's why the lady feels good inside, whereas the man feels good on the outside, right? So it's literally like the same organ developed, reversed, inverted. So sorry, why did I even talk about this? It just came to my mind, and I was just thinking it was an interesting topic because I saw that medical documentary on childbirth and how a child develops. All right, yeah.
Yeah. Thank you. Those are actually interesting questions. Thank you for all your questions that you have given us tonight. To our Sir Sean and Doc Jansen. Okay. All right, another question. Can a transgender have cervical cancer?
That's interesting. Because there are some operations where they pushed it inside.
Yes.
Right?
Let me think.
Oh, is that how it's done?
Do you know that for transgender operations, like transgender woman, sorry, that means used to be a guy and becomes a woman, can still have orgasms. They literally move all the what's that called? The nerves, the pleasure nerves, they move it inside. So they actually can feel pleasure like a woman.
Like a woman, I see.
Yeah, so I guess in that sense, if they have a HPV infection, Doc is researching, because that's an unusual question, because 10 years ago not many transgender, right?
Yeah. Okay.
In our previous webinars, we had discussion about getting your boobs done. Can it trigger cancer? And now this one.
Yes.
Yeah. Okay. Here's the thing.
Okay.
If this guy has a neocervix already or a neovagina,
which is constructed.
Yes, constructed. Okay.
Then yes, they can have cervical cancer.
But it's a small chance.
Okay.
Why? It's because they do not have
the fallopian
the
tubes
tissue,
or the tissue, or
the type of tissue that women have at that
area. Because just is a constructed one.
Yes, because it's artificially constructed anymore. Now, they're inside the cervix. Okay, so I keep on repeating cervix. There's a specific part of the cervix where HPV specifically attaches to, and where cervical cancer specifically develops. Okay.
All right.
It's a very specific area. Okay. Actually, that area is the one that the doctor swabbed. Okay.
So a transgender woman.
A transgender woman do not have this area, this specific type of tissue. However, if this person gets infected with the virus, with the HPV virus, and this person can still develop cancer. However, it will not be called cervical cancer anymore. Okay, it might be called a neocervical cancer or a neovaginal cancer.
It means it's a new term because it's a new.
Definitely not a prostate one.
Yes. So another thing is, if this person have not had vaginoplasty or have not had surgery, there's no chance that this person can develop cervical cancer because the person does not have a cervix.
All right.
That's good news for them.
Yeah, so that means if they haven't fully gone through the transgender process, they can't get cervical cancer. I see Mr. Nathan asking if using condoms for birth control can develop cervical cancer.
No,
in fact, it's the opposite. It will protect the lady from getting cervical cancer.
Correct.
Yeah. So if you have loved ones, who are not married, number one, unwanted or unplanned childbirth could severely affect a person's life. So always encourage them to use condoms. It not only prevents unwanted pregnancy, it also protects them from venereal diseases and specifically even cervical cancer.
Thank you so much, Sir Sean, Dr. Jansen. Another question: should I reschedule my Pap smear if I have menstruation? Please no.
Yes, of course, because otherwise the doctor will not be able to visualize the cervix because everything will be bloody.
Yeah.
Yeah, so reschedule.
Yeah, reschedule it.
Anyway,
Reschedule it.
I mean, it's every 3 years, so there's no specific month for you to undergo the Pap smear. So as long as it's within the year, I mean, you can reschedule.
Okay. All right. Thank you, Dr. Jansen. Can a Pap smear detect ovarian cyst?
Ovarian cyst, no. Ovarian cyst is way up. It's in the cervix. It's in the ovaries. I mean, it's in the ovarian cyst, right? Pap smear, we only are able to see up until the cervix, the vaginal side of the cervix. Okay.
Thank you, Doc. Okay, I think this will be our last question for tonight. Okay, is cervical cancer connected to breast cancer?
Cervical cancer connected to breast cancer? No. No. Again, very different reason why you develop these diseases. So again, cervical cancer, you develop that because of HPV infection. Risk factor would be it's sexually transmitted. Breast cancer, no. Breast cancer is lifestyle related and genetically related. Okay.
On this topic, I just wanted to also share in case many people don't know. You know, when we say a cancer spreads, let's say you have breast cancer, and it spreads to your bone and your liver, okay? It doesn't mean that you have bone cancer or liver cancer. The cancer in your liver or bone is breast cancer cells.
Yes.
All right?
Yes.
So, you know, when I was young, I was also confused. I thought, oh, cancer means cancer. That when your breast cancer spreads to the bone, it means now you have breast cancer and bone cancer. No. It means that the breast cancer, now you have breast cancer tumors in your liver. That's what it means when they say that your breast cancer spreads to the liver. It also is the same if your liver cancer spreads somewhere else, right? It's the liver cancer in another location. Okay? So just something to clear up in case there are new viewers and are new and curious to cancer. And when we use the term metastasis, which means the cancer has spread, it doesn't mean that you now have liver cancer. Because some cancers are really very difficult to treat. And small cell lung cancer is one of them. Liver cancer is also very difficult. All right. So breast cancer spreading to the liver, I think, is easier to treat than liver cancer spreading to for example, the lungs. You know, yeah.
Makes sense. Now I understand why, even though there's metastasis already for breast cancer, they still use the same protocol.
Yeah, they still use the same protocol because every different cancer uses different types of chemotherapy or immunotherapy. Yeah. So yeah, that's right.
Okay, thank you, Sir Sean. Thank you, Dr. Jansen. Can we just have just one more?
Sure.
One last question.
Last one.
Okay. Is there a period for consideration in conceiving after getting cleared from cancer?
Oh, after you are cancer-free, should you rest?
If you're cancer-free already, no, I mean you can get pregnant right away.
Okay, and to add to that, right now, we all know when you get pregnant, you want to be strong because your body is feeding another body. You're creating a baby. So if your plan is to conceive and you are just now in remission, I strongly encourage you to have a consult with Doc Jansen, right? Yes. To take a look at a professionally, medically done assessment of your nutrition. Because right now you're going to eat for 2 people, right? You also want to strengthen your body. Your immune system, again, is very important during all this time because you don't want, let's say, recurrence during your cancer. I actually have a patient who, she had multiple brain tumors and she was pregnant. So number 1, she can't use chemotherapy because if she uses chemotherapy, it would hurt the fetus. So she just went on pure Simply Nature PPARs, and the tumors, the growth actually arrested, and the tumor shrank. It didn't totally disappear, but it shrank and it stopped growing. And she was able to successfully give birth to her child. After she gave birth to her child, then she went through the other protocols, right? Because now the baby's out, it's safe to use chemotherapy and other things. So that's just for everybody's awareness. I hope these cases gives you some idea, and maybe you can share with your friend or loved one if they're in that condition, and it will give them a lot of hope, right? And also, more importantly, they will know what to do.
Very encouraging. Thank you, Sir Sean. Thank you, Doc Jansen. Of course, as mentioned a while ago, for those people who wish to have a consult with Doc Jansen, the link for you to schedule is on the description box, or you can just simply type in how to consult. We'll get in touch with you after the program. Okay. All right. Of course, this is once again our first webinar for 2023. Okay. I'd like to ask for your quick parting words to our viewers for tonight. Starting up perhaps with Doc Jansen and then with
Go, Doc.
Okay, so our topic for tonight is really very important, no? So, by getting vaccinated for cervical cancer, you prevent yourself from getting it, right? And not only that, you save yourself physical what's the term? Physical trauma or physical hardship in the future. Not only do you prevent that, you also prevent yourself getting emotional difficulties in the future, especially in your married life. Okay, I've had heard patients got separated, married life destroyed because of such things. Okay, also for men. Okay, getting vaccinated for HPV is not only for women. Okay, us men also should receive HPV vaccine, because usually it's us men who carry the HPV virus. Okay, because if you take a look at the chances, no, probability, it's usually the men who are more sexually active, more promiscuous than the women. Okay, if you take a bigger picture, I mean, no, so get vaccinated. It's not only for yourself; it's also for your future partner. Okay, and since what we were talking about a while ago is about Pap Smear, so get screened. Okay, don't worry too much about the scheduling or the frequency of getting tested. Every 3 years is enough. If you get it earlier, not much benefit. If you get it later, not much later. No? If you missed a year, it's okay. So you get it the following year.
But get it done.
But get it done. Okay?
But get it done.
So that would be my final message for tonight. So I'll give the floor to Shan.
Before we because I saw on our YouTube there was a question, and this one is interesting. It's from Archie. So I do want to answer Archie. Archie says, is unregulated cell reproduction, can it be corrected to avoid recurrence of cancer?
Yes, of course. Unregulated cell reproduction. So unregulated cell reproduction is basically cancer. Okay, so you can do that with different methods. So you can do that naturally. You can do that chemotherapy, medically, meaning pharmaceutically. Can you do that using procedures like radiation therapy? Yes. Can you do a combination of those?
Yes.
To prevent? Yes, all the better. Yeah. Okay. So for natural methods, Simply Nature PPARS is one of them. Following a specific dietary pattern is also one. Lifestyle, physical activity as well. No. These methods are one of them. Next would be chemotherapy. Yes, it's one of the basic tenets of chemotherapy is to stop cell reproduction. There are certain chemotherapy drugs that stops this. Okay, radiation therapy is also one. Okay, so just destroy. But however, for radiation therapy, it's more of a direct damage. No, so it really destroys the tumor itself. For immunotherapy is different.
And we will be covering immunotherapy this year.
Yep.
So in this first quarter of the year, we will actually go more in depth to understand immunotherapy. So that's something we can all look forward to. I learned a lot in my discussions with Doc Jansen about this topic.
Yeah.
So for Mr. Archie, please arrange for a consult with Doc Jansen so that you can really we can really go down and come up with an action plan, right? You know, when we answer questions like this, it's knowledge. You know, knowledge can't save you. What you really want to do is come up with an action plan that you can actually do something and make a difference. On my part, it's a new year. Over the new year, I had the privilege to actually continue to work and support a new cancer patient. Actually, I was talking to a cancer patient. He called during my Christmas dinner with my family. You know, so and we started our relationship there. And what I told him during New Year is what I want to tell everybody. A new year is a new start. So whatever baggages and discouragement from 2022. Put it aside, start a new year, especially to the cancer patients, right? It's like mentally you just make a choice that you step into the new year, new possibilities, new hope, new fight, new success. All right, so that's my wish to all our viewers, especially those who are fighting cancer. 2023 is a new year, so let's start it with full of hope, new chance, right? That you will beat this cancer and you'll live long and you'll have a great life ahead of you. So to everyone, once again, Happy New Year. 2023 is going to be the best year of your life yet.
Thank you, Sir Sean. Very encouraging, and you both of you, Dr. Jansen and Sir Sean, has really made us all excited for this 2023 upcoming events that we have here in Simply Nature. Just very quick announcement. First off, of course, for next Thursday, January 12, 7:30 again, we'll have the topic, Finish Your Chemo, No Serious Side Effects. We hope to see you next week.
Oh, that's Dr. Jimmy. That's our oncological surgeon.
Correct.
That's very interesting. It's coming from an oncological surgeon. Yeah.
That's correct. Also, I just want to let you know that today is the last day of our 1/1 mega sale on Lazmall. So for those of you who wish to, don't miss that one. Like I said, it's the last day today. Okay. So, just like what Sir Sean and Dr. Jansen has mentioned, your victories from cancer is what keeps us going here in Simply Nature, and we really wish to see you once again in our next episodes here in Simply with Healed webinars, because here in Simply Nature, we are always with you from start to healing. Once again, Happy New Year and God bless you all.